Welcome to Witham Sounding Board, a podcast sharing powerful business tips, insights, and trends for those seeking to become a rock star in their industry.
We are back at it again for another edition of Witham's Hot Topics in the Multi-Employer World. I'm your host, Aaron Slaughter, and today we have Linda Vincent with us from The Identity Advocate. Thank you so much for joining us. And I'd like to start today by just asking you to tell us a little bit about your story and your journey from practicing as a nurse into the interesting things that you are doing now.
Well, thank you, Aaron, and thanks for inviting me to speak with you and your audience. My story is sort of interesting. I graduated from nursing school what feels like 1,000 years ago some days. And after I got through nursing school, worked in an emergency room. We were the major medical center between Dartmouth up in Vermont and Boston Medical Center, any of the Boston hospitals down there. Then I went back to school to get a bachelor's. And during that time, I transitioned over to the only other little hospital that we had in Concord, New Hampshire. That was a state hospital where I went to work in what they call the forensic unit, where the criminally insane were housed. And if everyone remembers the movie that Nicholson was in of One Flew Over the Cuckoo's Nest, that was my unit. And it was a very interesting year as a 22-year-old, almost fresh out of school nurse who had a lot of interesting characters who were, quote, criminally insane, or at least proclaimed that they were. I then had a vacation, came to California, and looked at the number of ads in the newspaper saying, wow, look at all these nursing ads, and didn't think much about it until I flew back home. And when I flew back to Boston, the car was plowed in, the brakes were frozen, it only went in reverse. And I said, that's it, I'm done, come graduation time, I'm back to California. And that's what I did, and came out here and worked again with kids, with psychiatric patients, and then chemical dependency. The problem was, after a few years, they shut my unit down. And then you always ask yourself as a nurse, what do you want to be when you grow up? And started looking at some of the interesting ads in the newspaper and got into the business side of nursing and healthcare, which as a nurse, when you're in school, you don't hear that much about. So started what they call auditing. So the insurance companies would hire us. We'd go out and look at the hospital claim and compare it to what was billed and if there were errors, and discovered quite a few errors before all of technology does what it does today. There are still errors out there. So, but during that time, I also discovered there were other interesting events we found. Doctors' identities being used for different kinds of billing. So it piqued my interest in what eventually became identity theft, eventually looked at where money was being lost, and so thought I might find some interesting things in there. I don't sit still well, so therefore thought, well, let me see what this can be. The company I worked for also would send nurses out on some of the actual investigations that they were conducting, because they were going to see a doctor or they were going to see a nurse because of her claim of injury at work, or they wanted to get the underwriting going on. So again, all of this was adding up to looking differently at how things were billed and what the care was and how the care was documented. Because in anything, especially as you, maybe as an auditor, if it's not documented, it's not done. And therefore, those are things we looked at. So I got the number of hours and sat down and passed the private investigator's exam. Here it is, though, I only do healthcare. I don't go after bad husbands. I don't go after bad wives. I don't do all that fun stuff that you see on TV. So that was pretty much how I got started in this, and decided that I started the Identity Advocate because of my belief in education. I believe that if you know or begin to know what you don't know, you'll find the answers and find solutions to problems you may discover that you didn't know that you had. So that was the beginning of the Identity Advocate: more speaking, more education, more workshops. And so here I am today.
Wow. Well, I will say that's really impressive. That's impressive for you to be able to leverage your skills and talents and interest into something and make this transition all the way from being a nurse into this identity and healthcare fraud. So that's a nice segue, because what I'd like to ask you next is if you can share just some of the statistics around healthcare fraud, because I'm sure you've seen a ton of things in your time. And if you could speak at all to just what some of the healthcare fraud looks like as far as statistics for our listeners, I think that would be great.
The statistics are scary as far as I'm concerned because it's our money in the long run. Healthcare fraud started off, I think, without a lot of planning by doctors, but they found small ways to get more money into their practices and stay ahead of the game, if you want to call it that. Some of the monies that have been lost to fraud, they say that it's 3 to 10%. I don't ever see it being as small as 3%. My belief it is more along the 10% line. So if you look at the recoveries that maybe we can mention towards the end, the dollar amounts that you have in recovery, then you will also understand how much money is lost to fraud. So if you have a budget for your healthcare, for your organization, be it labor, being the trust fund, working with an ASO account, your Blue Cross, your Blue Shield, and you take just 10% of that money that could be put into other benefits for your clients towards your retirement. But also the thing that everybody, fraud's the big word, but then there's waste and abuse. And waste and abuse takes up 20 to 30%. And one of the things you might look at with waste, and we'll try to do a little bit more as far as how you can look more closely at this. But when you go in to see a doctor, you have that 10-15 minute visit. It's called like a 99212. Not a big deal. Come in, geez, I've had the cold. Can you offer me a prescription? I know I haven't seen you in a year. That's why you want me here. Or you're in for a follow-up visit because of this cold that hasn't gone away. You need a half an hour. So that might become a 99214. The difference between those two codes, let me get my numbers out. The difference between those two codes, say the 10-minute visit is probably $62, and that quote 20-minute to half an hour visit is $140. So you get around an $80 difference. Well, if you do that on every patient that comes in to see you on a particular day, you've got $1,000, $1,500 going into your pocket. And you do that, say, 4 days a week, you've got maybe like an extra $6,000 during the week. So that's where I look at waste and abuse. And if you do enough in waste and abuse, it becomes fraudulent. So you have this physician who always upcodes, always has an opportunity to say, well, he really could have had this injection but didn't, or I should have ordered x-rays but I didn't, but charged for them anyway.
I think that's a great point, and I can tell you that as an auditor of health plans and welfare plans, whenever I speak about fraud at a conference or maybe doing some individual teachings on fraud, I always take a pause here when we talk about statistics, because I ask everyone in the room to raise your hand if you think there is healthcare fraud in your plan. And you see everyone look around and people are a little shy to put their hands up. And I tell everyone, you should absolutely have your hand raised, because the likelihood that there is not fraud happening at your organization is probably remote. So it's alarming. It's scary when you think about it. You bring up a great point of just the abuse and how that can escalate and then turn into fraud. So it's definitely something that we want to be on the lookout for. So next, I would like to ask you just what are some of the ways that we can safeguard, and for everyone listening at home, whether you work for a healthcare plan or whether you are in the healthcare industry, how are some of the ways that we can safeguard our organizations as far as what we want to focus on as to how we can prevent fraud or even protect ourselves?
Preventing fraud is probably the best way instead of doing what they call pay and chase. So when you pay a claim and you discover that this particular provider is a problem, then you try to go after your money. It's very difficult. Protection is important for your members because sometimes they are harmed during some of the fraudulent activities that might be happening to them during their care. And, the dollar amount when we were on the former topic, being 230 billion a year, as you said, when you're in auditing your funds, that is an enormous amount of money. So when they start, if you can have a program that cleans your bill, scrubs the data, and then sends it out for payment, whether you are self-insured, whether you have an ASO, or whether you send it off to a Blue Cross or a United or a Humana for payment, then you don't have to get that money back afterwards. So you will have the chance to say, oh, those are programs that can be purchased. You can develop them for your own systems if you're a small fund, like I work with several small funds that aren't more than a couple thousand lives. And you protect the fund in that regard. You also offer education to your members and the people that have their healthcare with you. Again, whether it's the ASO, whether it's the Blues or Anthem, and tell them to watch their EOBs. I know it's something that sounds really boring. It sounds like it's not something you want to do. It's like looking at your grocery receipt when you come home from the store. How often do you do that? Well, I was at the doctor's. Yeah, I had these charges. I just the other day looked at a bill that I got in, and I will be calling on it because there's something that doesn't make sense to it. And I think teaching and offering education to the members is a protection that can be had, whether payroll stuffers. Now, I think I might be dating myself. I don't know if anybody gets a paycheck anymore, or is it all automatic deposit and withdrawal? So therefore, is there such a thing as a payroll stuffer? But there might be newsletters, the same way as you want to see if you can have the opportunity for education. And in that protection mode, there's always somebody like a nurse in your organizations, because they're always somebody that's curious. And that's the person you want to tap into, saying, would you be interested in reviewing claims before we send them for payment? Because we think there is a chance that there's some misadventures in billing going on. The financial misadventures, like the old days, putting an extra zero in after you got 8 tablets of, say, Valium while you're an inpatient, and making that an 80, really, that does not happen as much as it did in the old days when I first got into auditing. But if you offer that little incentive sometimes to your members, saying, we will give you a $25 gift certificate to Chuck E. Cheese's, to California Pizza Kitchen, or something like that. If you can find errors on your bill, and you would be surprised what a driver that is. So that goes, in my opinion, along with the protection. Again, if you can find a program, and we can discuss this later, that scrubs your claims and gets them clean before you send them out. There are several organizations that are finding this to be better for all organizations, including your Medicares, your Medi-Cals, to make sure that you've got a clean claim going and you don't have fraudulent activities that you're paying for.
I think you brought up several great points there, Linda. So thank you for that. When you talked about the nurse who could be in the building on staff and can provide insight, I think about when casinos hire former crooks to help spot the cheats and help find out when people are trying to scam on the casino or count cards or any of those techniques. But the other point I wanted to say was I cannot harp on just the educational piece, because I think about in our own personal lives when you receive a bill and just not knowing what some of those codes mean, or not knowing that a doctor could be upbilling, like you said, or maybe even charging you twice for the same thing and calling it a little bit something different. And just as lay people, we don't know some of that sometimes. So I think those are excellent points.
I agree. And when you do call and you say you've got something wrong, obviously your first call should be to the carrier. If it's the self-employed group, then call into the claims department. If it is your ASO, your Blue Shields, your Blue Cross that is the payer, have to make sure you have contract language in place to say, what are you going to do if a member calls you? And it should be at the bottom of most EOBs these days, saying, if you believe that you have been fraudulently charged, then we want you to call us. And that becomes more important. Your TPA language, again, making sure that you have protection for you, for the fund, and for the member.
So we've talked today about just some of the ways that we can safeguard our organizations. We've also heard a little bit on statistics. What I'd like to talk about next is just some of the ways that people are committing fraud. And if you could speak at all to how you might see this manifest itself in your organization or even in your own personal life.
Oh, the most fun part of fraud is who's doing what and how they're trying to do it and what the bad guys are doing and the newest and latest and greatest scheme, except that what it comes back to is the 4 or 5 ways that they automatically get involved in fraud. One of the first things is upcoding. Upcoding was what I discussed actually on the prior thing, where it comes into waste and abuse, where you go in to see the doctor and he makes you, quote, sicker, unquote, than you are. You go in, you just want a prescription because you've got this stupid sinus infection. So you see him, he sees you, gee, that's fine. But he upcodes it because he thinks, and he will documented that you've been there for 20 or 30 minutes when that really didn't happen. He saw you, he smeared the nasal swab, sent you on your way with a prescription. So he's upcoded that. Cardiologists, unfortunately, back a few years ago in the Midwest area, were also inclined to make you sicker cardiac-wise so that they could go in and do procedures or perceived procedures of diagnostic cardiology games that they would play and that they would bill for. Years ago out here, there was the sweaty palms, I think that's what they called it in the old days, where you had the sweaty palms, and so therefore you went to see the doctor, and the doctors were having to cut a particular nerve so that you didn't have sweaty palms, but wouldn't try something else in between to get rid of your sweaty palms. As a side note, if they do cut that nerve so you don't have sweaty palms, you will sweat someplace else, whether you're a man or a woman, and you never know where that someplace else is going to be. Just something to think about when these people want to do things. Again, do no harm if you're a doctor, and yet this is something that you wouldn't ever think about, what's going to happen next. So again, fraud
Listen, as someone who sweats a lot already, I don't even want to think about other places that I could be sweating.
No, you probably don't want to do that. And especially if you're a girl, you don't need that heart-shaped sweat on your chest. Okay, we won't go there, but that's something for your audience to take a look at, saying, wow, I never thought of that. Because if you do damage to one part, something else will probably pop up. Unbundling is another favorite way that physicians get more money. So you go in and going back to, say, this infection that you have. So instead of just giving you the prescription, he claims and he bills that he's given you an injection to start with, to say, we're going to kick this off really tough to get rid of this infection. So we're going to give you an injection. They don't get the injection. So, but they've unbundled it. Oh, and you're having this difficulty breathing. We're going to give you what they call blow bottles to get your chest expansion. But they really haven't given you that. So they've unbundled all of these charges. That happens in a hospital where you go in for a particular surgery and they give you then, or they charge you for a particular tray for your particular kind of surgery. Well, then instead of charging you for that tray because you're having an endonasal procedure, what they do is they take everything off that tray and charge it out separately. And labs are notorious. And they've tried to fix this, but they haven't been quite successful all the time. There are still some labs that get into trouble with this, where they unbundled what they call a SMAC 12 or the SMA 12, where you do 12 tests. And it should come out all as one bundle, all as one charge. But what they turn around and do is charge you separately for each of those lab costs. They are charging for patients they don't see. During our investigations, we go in and ask for daily logs because they will say, oh, they were supposed to be here, they didn't come, we're charging them anyway. Or they are having a sleep apnea test, but they don't show up and they send the test home and the patients never do it. So they're seen, or their diagnosis is saying they should be having a sleep test and that's not done. Telehealth is its own new chance of opportunity for fraud, where they will have doctors who've never seen the patient, not a problem because that's what telehealth is about, but they've never actually talked to the patient. So they're ordering the oxycodone, they're ordering the braces, they're ordering urine tests and lab tests that may never get done. But that's where telehealth is having to come into its own. And the referral system, even into hospice, they get kickbacks for signing the person off that they need hospice when they may not need hospice, they just need some extended care. So those are the general ways where they do the billing and find ways to increase it.
Excellent. So what I would encourage all of our listeners to do is just think about those 5 different buckets that Linda shared with us, and almost like when you're riding on Amtrak or flying, when you see something, say something, because you never know what you could be uncovering as far as just some of this fraudulent healthcare charges that we're talking about today. So do you have any advice for what our listeners should do if they ever do stumble upon fraud, and what are the remedies that they can take and actions that they can take in order to go against and combat what they're seeing?
I think that once you discover that you've got some fraud going on, the first thing you do is you call those who pay your bill. Would it be the fund office? Would it be your TPA? Would it be your ASO account? Because those are the people that are looking to say, oh my goodness, maybe this is not the first call they've had on this particular doctor. From an auditor standpoint, I know generally you are doing random audits, but on the other hand, you may be also the one finding out going, gosh, there's this cardiologist down here in Brownsville, Texas, and he is always doing the cardiac EKGs that are the walking, standing, and running, which run $1,000 to $2,000, and he does it on every patient that comes in. Maybe we should not do random. Let's pull this particular physician and take a look at him, and then go back to the fund office and or the TPA and say, why do we need this gentleman in our network? I know Medicare will do that now and then and discharge them from working with them and never can do Medicare billing again because of what you may have found in an audit, what a patient is saying. And again, that referral back to, well, if you find fraud, say something. If you lose your healthcare card, you should call definitely the fund office or the insurance, because somebody will go out and use that in lieu of them having to get healthcare. So is that person getting the healthcare the person that you really have insured? Again, it's one of those things where whose side of the fraud are you on? And the other things that you can do if you're discovering fraud is share that information. I know one of the things that the International Foundation is the perfect time for networking, but I will give some links at the end or some references at the end of where you can start to network, because there are the people that are like myself that are saying, this isn't right, we should look into this. And there are definitely some claims persons who are always curious, and those are the folks you want to get. Or there are organizations, I know even out here, some of the labor funds have hired nurses to look at some of the claims, because those are the first line of defense who might see that surgical procedure that has a tray on it that doesn't even belong with that particular surgery. Or one I looked at with one of my funds was, you can't put 2 of those ligaments in one knee. It just doesn't work that way. And when I talked to the hospital, I said, if you would like me to send you the documentation that the so-and-so foundation puts out for using their ligaments, I will be happy to do so. They took $35,000 off the bill. They knew exactly what they were doing. So yes, you want to talk to somebody. Don't let it slide.
Excellent. I think those are all great tips for people to just kind of store in their back pocket, and just as we go along and talk about this more, it's one of those things where the more you know, and hopefully when we're done this episode, people will know more about how to go about this than they did before tuning in. So shifting gears a little bit, can you speak at all to just what's the number one way or what some of the more frequent ways that organizations can get themselves into trouble as far as the healthcare world and opening themselves up to fraud?
By saying it'll never happen to me because we have managed care. And that has been
Mm,
around since I first started working within the fraud field in healthcare. Oh, well, managed care is here now. When this has to be about 20 years ago, when I began working with the funds and the coalition, it's like, well, we don't actually need that many audits anymore because managed care is here. Managed care does not stop mistakes. Managed care does not stop greed. They just find different ways to do it. So stop saying, in my opinion, that managed care is here, it's going to fix it. It doesn't. Managed care manages to make people get more inventive. How to get the kickbacks. Who are the doctors that are bad out there who want that little extra money in their pocket? They will sign off on that hospice order, even though they've never seen the patient, talk to the patient or the family, but they'll give you that because you're going to send $1,000 to their pocket. The recruiting scams with Medicare, it started first, and you will find it carries over if it's happening in Medicare. It happens on the private side of the genetic testing. Again, a little bit of telemedicine came into that. But what they were doing was hiring a recruiter, called up the member, patient, and told them it was going to be free. And once it says free, everybody says, oh, let me do that. And once free happens, then it goes out to a particular lab. The lab bills the carrier, and the money comes back. It's sent to the recruiter, who then sends a portion to the doctors. So you look at that whole wave, and that will happen in so many of the other areas of healthcare fraud, of how they're doing it, how they're getting their kickbacks, how they're making their money.
excellent. Can you speak at all to what people should do with their summary plan descriptions or just about their beneficiaries at all to help prevent some of the fraud that might happen?
I think the language in your SPDs, your summary plan descriptions, needs to be tight. I think sometimes we look at saying, gosh, I'd really like to get this device paid for my member because, he is one of the fast moving organizers and we want to make sure he stays healthy. But I think the SPD language has to be really tightened up. And that's when you can use some of your consultants, some of your auditors saying, this is what we've found. We want to make sure that we don't have this recurring. If you find a hospital system that is notorious for doing fraud, which we've had several out here in California, and they have several across the states, make sure that hospital system is not covered in your SPD. Tell the members they're going to have to kind of bucket up and say, you can't go there anymore. If you do, this is where you're going to have to pay cash. And if you have to pay cash, I can bet your bottom dollar they're not going to go back there to do that. They would rather have their carrier pay for it. But those are the things you want to look at. And if you have an ASO account or your TPA, you want to make sure that you have good audit language in there, not just about random audits, but saying specifically, we are looking for this abusive practice, and write that language in. Because if you don't have that as a backup, if it's not written, it's not done, like we said, you need to make sure that you have all the words you need to stand on to protect your members and to protect the fund and their money.
Thank you for all of this information that we've talked about so far. What I'd like to end with today is just a little touch on some of the links and websites and periodical names that our listeners can grab and jot down if they want to ever go back and refer to any of the organizations that we were talking about that might give them some insight or just some education for them as they go on and help try to stop some of these fraud numbers.
Okay. One of my well-known places, and again for education similar to IFEBP, is the NHCAA and the Fraud Institute that comes also through the IFEBP can be a resource. There are publications that are in conjunction with NHCAA and a group AHIP, AHIP. Again, it's on the hospital side, but also on the provider side and patients. The Department of Justice is a great resource because they'll tell you who's been arrested and you can say, oh my goodness, I used to go to him. Let my insurance carrier know that I might have some bills out there. HHS and their recoveries this year has been in the billions. I think for 2020, it was over 20 billion. So these people are looking closely. Smart Brief is a publication that's in partnership with the NHCAA, and the fraudeducation.com and North American Training. Again, they're all places you can look, you can ask, you can attend, you get newsletters, and see if there's something that you can utilize for your system. And the other place that, again, this might be a one-person assignment, is Google has what they call Google Alerts. So your gut tells you that this particular doctor that you've been seeing makes you nervous, and so you put his name in, and it pops up if something happens, or it pops up if somebody's done an arrest. It pops up when someone's done a complaint. So your Google Alerts, put a doctor name in, put a hospital name in, put a healthcare plan name in. So say you've got this health plan your fund is switching to, and you're going, geez, I really don't like this. Let me do some research on it. So Google Alerts is good for that.
Those are some excellent tools. And again, we will put the links and the names to these in the bio of this episode. Well, that does it. And I want to say a special shout out and thank you to Linda Vincent again today from the Identity Advocate. And for all our listeners out there, you could have been anywhere in the world, but you're here with us, and we appreciate that.
Well, I'm appreciating being with you in this part of the world.
I'm Aaron Slaughter, and stay safe, and we'll see you again for another episode of Hot Topics in the Multi-Employer World.
Thanks for joining us. Be sure to subscribe to our podcast so you'll be first in line to hear what's coming next. Don't want to wait for our next episode? Check us out at withum.com. That's WITHUM.com.